I need to tell you something before we even begin, because I think you deserve honesty more than you deserve a catchy promise. If you clicked on this video hoping I am going to tell you that you can throw away your glasses, cure macular degeneration, or grow back photoreceptor cells that have already died, I am not going to tell you that, because it is not true. And I have built my entire career on the principle that I would rather tell you something true and useful than something exciting and false. But here's what I am going to tell you. And I think by the end of this conversation, you are going to understand why what I am about to share is genuinely more valuable than a miracle cure ever could be. There is a meaningful, well-documented, scientifically supported category of vision improvement that has nothing to do with surgery, nothing to do with LASIK, and nothing to do with medication. It involves restoring function that has been quietly lost not through dramatic disease, but through years of strain, poor habits, nutritional gaps, and muscular changes in and around the eye that almost nobody ever addresses because almost nobody ever explains that they exist in the first place. My name is Dr. Richard, and what I want to walk you through today is the real, evidence-based landscape of natural vision support, what actually works, what the research actually shows, who it genuinely helps, and just as importantly, what it cannot do and where the limits of natural approaches genuinely sit. Because I think the conversation about natural eye health has been badly served by two extreme camps. One camp tells you nothing natural works and your only options are glasses, surgery, or accepting decline. The other camp tells you that eye exercises and herbal eye drops can reverse blindness. Both of those extremes are wrong, and the truth, as it usually is in medicine, sits in a more nuanced and more genuinely useful place in between. Before we go further, I need to be direct about something important. Everything I share today is for educational purposes. It is not a substitute for professional eye care. If you are experiencing vision changes, eye pain, sudden vision loss, or any concerning symptoms, please see a qualified eye care professional promptly. Some forms of vision loss require urgent medical attention, and delaying that care while trying natural approaches alone can result in permanent and preventable harm. What I am about to share works alongside professional eye care. It does not replace it. Now, let us talk about what is actually happening when people say their vision improves naturally, because the mechanism matters enormously. And understanding it will tell you exactly what to expect and what not to expect. There are essentially three distinct categories of vision change that natural approaches can genuinely influence. And I want to walk through each one carefully, because lumping them together is exactly what creates the confusion and the false promises that dominate this space online. The first category is functional vision strain, what happens when the muscles controlling your eye's focus and the surface tissues of your eye are under chronic stress from modern visual habits. This is real, it is common, and it responds genuinely well to specific natural interventions. The second category is nutritional support for the structures of the eye that depend on specific micronutrients to function and to slow age-related decline. This does not reverse existing structural damage, but it can meaningfully slow the rate of further deterioration and, in some documented cases, improve specific functional measures like contrast sensitivity and glare recovery. And the third category, and this is the one I want to be most careful and most honest about, is genuine structural and disease-related vision loss. Macular degeneration, glaucoma, diabetic retinopathy, advanced cataracts. For this category, natural approaches have a supportive role, sometimes a meaningfully protective one, but they are not a cure. And anyone who tells you otherwise online is either misinformed or is trying to sell you something. I think it is worth pausing here to address something honestly, because I suspect some of you watching this came specifically hoping to hear that eye exercises could replace the glasses you currently wear, or delay a surgery your doctor has recommended. I want to address that directly rather than letting it sit unaddressed. If you have a genuine refractive error, nearsightedness, farsightedness, astigmatism, these conditions result from the physical shape and length of your eyeball and the curvature of your cornea and lens. They are structural anatomical characteristics, not muscular weaknesses that exercise can correct. No amount of eye exercise changes the physical length of your eyeball or the curvature of your cornea. This is different from the accommodative fatigue we discussed, which is a functional, muscular issue layered on top of whatever your underlying refractive status happens to be. Eye exercises can genuinely improve how efficiently your visual system functions within your existing refractive status. They cannot eliminate the need for correction if you have a genuine, structural refractive error. Glasses, contact lenses, and refractive surgery exist because they address something that muscular training cannot reach. Understanding this distinction prevents the frustration of expecting an outcome that was never realistically achievable from the techniques being described, while still allowing you to benefit fully from what these techniques can genuinely accomplish. Let us start with the first category, because I think it is the most underappreciated and the most immediately actionable for most people watching this. Here is something that almost nobody explains clearly. The focusing muscle inside your eye, called the ciliary muscle, is a genuine muscle. It contracts and relaxes to change the shape of your lens, allowing you to shift focus between near and far objects. And like any muscle in your body, it can become chronically tense, fatigued, and less responsive when it is held in one position for extended periods without variation. Modern life puts this muscle under a kind of sustained, monotonous demand that simply did not exist for most of human history. Hours of close focus work on phones, computers, and reading material, with very little variation in focal distance throughout the day. Research published in the journal Ophthalmic and Physiological Optics has documented that sustained near-focus work produces measurable, if often temporary, changes in accommodative function, the technical term for the eye's ability to shift focus efficiently between distances. For some adults, particularly those whose vision complaints involve difficulty shifting focus, eye fatigue by the end of the day, or blurriness that worsens with prolonged close work and improves with rest, a significant portion of what they are experiencing is functional strain rather than structural decline. And functional strain responds to specific, well-documented interventions. The most evidence supported of these is something called the 20-20-20 rule, but I want to give you a more complete and more clinically useful version of it than the simplified version that circulates online. Every 20 minutes of close visual work, look at something at least 20 feet away for a full 20 seconds. This is not a suggestion. The research behind this is specific. A study published in Optometry and Vision Science measured accommodative fatigue in adults performing sustained near work and found that structured distance focus breaks at this interval significantly reduced measures of ciliary muscle fatigue and improved subjective symptoms of eye strain within a 2-week intervention period. But here's what most people get wrong about this technique. 20 seconds is a minimum, not an ideal. And looking at something 20 feet away that is also stationary and similarly close to your visual habits like another screen across the room provides far less benefit than actually shifting your gaze to something with genuine depth variation. A window with a view of trees, buildings, or sky at varying distances engages the ciliary muscle through a genuine range of motion rather than a single alternate fixed point. There is a more advanced version of this that I recommend to patients dealing with significant accommodative fatigue, and it is something I rarely see discussed publicly. It involves what is sometimes called focus shifting or accommodative flexibility training. Hold your thumb approximately 10 inches from your face. Focus on it clearly for 3 to 5 seconds. Then shift your focus to an object at least 20 feet away, holding that focus for 3 to 5 seconds. Repeat this near to far shift 10 to 15 times to 2-3 times per day. A study published in the Journal of Optometry found that adults who performed structured accommodative flexibility exercises over a 6-week period showed measurable improvements in the speed and accuracy of focus shifting compared to a control group. This does not change your eye's structural prescription. It is not going to eliminate the need for reading glasses, if you genuinely need them due to age-related lens stiffening. But for the significant subset of vision complaints driven by muscular fatigue and reduced accommodative flexibility rather than structural change, it produces a real, measurable, documented improvement in how efficiently and comfortably your eyes function day to day. Now let me address something connected to this that I think deserves serious attention and almost never gets it. Blinking. This sounds almost too simple to matter, and that is precisely why it gets overlooked. When you focus intensely on a screen or close reading material, your blink rate drops by as much as 60% compared to your normal resting blink rate. This has been documented repeatedly in research on digital eye strain. Reduced blinking means reduced distribution of the tear film across your corneal surface, which leads directly to the dry, scratchy, fatigued feeling that so many adults over 50 attribute simply to aging eyes. Your tear film is not just water. It has 3 distinct layers: an oily outer layer that prevents evaporation, a watery middle layer that provides hydration and nutrients, and a mucus inner layer that allows the tear film to adhere evenly to your eye surface. Each time you blink fully and completely, you redistribute and refresh all 3 layers. Partial blinking, which becomes habitual during screen use, fails to fully refresh this film, leading to localized dry spots on the corneal surface that create exactly the blurry, gritty, fatigued sensation that people commonly experience and commonly misattribute entirely to age. The fix is genuinely simple and genuinely underutilized. Consciously practice full, complete blinks, not faster blinks, complete ones, where your eyelids fully meet roughly once every 4 seconds during sustained screen use. This sounds almost absurdly basic, but a study published in Investigative Ophthalmology and Visual Science measured tear film stability before and after structured full blink training in adults with digital eye strain symptoms, and found significant improvements in tear film breakup time, a direct clinical measure of tear film health, after just 2 weeks of consistent practice. This is functional vision support. It is real, it is documented, and it costs nothing. There is one more functional technique I want to give you, because it addresses something slightly different from focus fatigue, and patients consistently tell me it produces a noticeable, immediate sense of relief, even though its longer-term evidence base is more limited than the techniques I have already described. It is called palming. Rub your palms together briskly for about 15 seconds until they feel genuinely warm. Then cup them gently over your closed eyes, without pressing on the eyeball itself, simply resting the warmth of your palms over your eye sockets. Breathe slowly. Hold this position for 1 to 2 minutes. What is happening here is straightforward. The gentle warmth increases blood flow to the small muscles around your eyes and to your eyelids. The complete darkness removes any visual input entirely, giving your visual processing system, including the muscles that have been working continuously, a genuine rest period unlike anything a typical break provides. Several small studies have measured reduced muscle tension around the eyes and improved subjective comfort scores following structured palming sessions, particularly in populations with significant digital eye strain. The evidence here is more limited than for the distance focus and blinking techniques I described earlier, but the technique is risk-free, costs nothing, and many of my patients report genuine subjective relief, particularly when practiced consistently during breaks and screen-heavy work. There is one more dimension I want to address, because it connects directly to everything we have discussed, and it is something almost nobody thinks about as part of their eye health routine: the visual environment you work and read in. Lighting matters far more than most people realize. Reading or working in inadequate lighting forces your pupil to dilate further than it would under proper illumination, which reduces depth of focus and forces your ciliary muscle to work harder to maintain a clear image. Over hours of daily use, this compounds the accommodative fatigue we discussed earlier. Research on optimal task lighting consistently recommends illumination levels significantly higher than what most home reading lamps provide, somewhere in the range of 500 to 700 lux for sustained close work, compared to the 100 to 200 lux that a typical living room lamp produces. A simple, inexpensive adjustable desk lamp positioned to illuminate your reading material directly, without glare reflecting back into your eyes, can measurably reduce the visual effort required for the same task. Screen glare is a related and equally under-addressed issue. Position screens to avoid reflections from windows or overhead lighting, and consider that the blue-enriched light from many devices, while not causing the structural retinal damage that some online sources dramatically claim, does contribute to visual fatigue and circadian disruption when used in the hours before sleep. A warmer color temperature setting on your devices in the evening hours, combined with adequate ambient room lighting rather than working in a dark room with only a bright screen, reduces the contrast-driven strain that comes from your pupil constantly adjusting between a bright screen and a dark surrounding environment. Now let us move to the second category: nutritional support for the structures of your eye that genuinely depend on specific compounds to function optimally and to slow the rate of age-related decline. I have covered the specific nutrients in detail in other conversations: lutein, zeaxanthin, omega-3 fatty acids, vitamin C, vitamin E, zinc, and vitamin D each play a documented role in supporting different structures inside the aging eye. I am not going to repeat all of that detail here, but I want to address something specifically relevant to this conversation about natural healing: the question of what nutritional support can and cannot reasonably be expected to do. The honest answer, grounded in the actual clinical research, is this. For adults with early structural changes, early cataracts formation, intermediate macular degeneration, mild dry eye disease, appropriate nutritional support has been shown in controlled research to measurably slow the rate of progression, and in some specific functional measures like contrast sensitivity and glare recovery, to produce genuine improvement. The AREDS study I have discussed previously demonstrated a roughly 25% reduction in progression risk for intermediate macular degeneration with a specific evidence-based nutrient combination. This is genuinely meaningful. A 25% reduction in progression risk, sustained over years, is the difference between maintaining functional reading vision and losing it for a meaningful number of people. But I want to be precise about the language here, because precision matters enormously when we are talking about people's hope and their health decisions. This is risk reduction and progression slowing. It is not reversal of existing structural damage. If photoreceptor cells have already died, if lens proteins have already aggregated into a visually significant cataracts, nutritional support will not undo that. What it can do is meaningfully protect what remains and in some cases, improve functional outcomes within the tissue that is still healthy. Drop a comment below right now and tell me, have you ever tried a specific natural approach for your vision? And did you notice a real difference? I want to hear your actual experience, because real-world reports from people genuinely trying these approaches matter to me as much as the clinical research does. Now let us address the third category directly and honestly, because I think this is where people get hurt the most by misinformation and where I want to be most careful and most clear. For genuine structural eye disease, glaucoma, diabetic retinopathy, advanced macular degeneration, significant cataracts that are affecting your daily function, there is no natural approach, no exercise, no supplement, no herbal preparation that reverses the underlying structural damage. I want to say this as plainly as I possibly can, because the financial incentive to tell you otherwise online is enormous. And the people selling miracle eye drops and reversal programs are not accountable to your actual outcomes the way your eye doctor is. Glaucoma involves progressive damage to your optic nerve from elevated eye pressure or other mechanisms. That damage, once it has occurred, is permanent. The nerve fibers do not regenerate. The only meaningful approach is preventing further damage through appropriate medical management, which may include prescription eye drops, laser treatment, or surgery depending on severity. Diabetic retinopathy involves damage to retinal blood vessels from elevated blood sugar over time. Managing blood sugar genuinely helps prevent further progression, and this is an area where lifestyle factors are legitimately powerful, but it does not reverse vessel damage that has already occurred. Advanced macular degeneration involves death of photoreceptor cells and retinal pigment epithelium in the macula. Once those cells are gone, they do not come back. Cataracts that are significantly affecting your vision and daily function genuinely require surgical removal, and I want to be clear that modern cataract surgery is remarkably safe, effective, and is not something to fear or to delay indefinitely while trying natural alternatives that cannot achieve the same outcome. I share this not to discourage you from natural approaches. I share it because I believe you deserve to make decisions about your eye health based on accurate information about what is realistically achievable, rather than hope-driven marketing that can lead people to delay necessary medical treatment while pursuing approaches that were never going to address their actual underlying condition. I also want to address something that connects directly to everything we have discussed today, because it is the foundation that makes every other intervention more effective or, if neglected, undermines all of them. Sleep. Your eyes, like every other tissue in your body, depend on adequate sleep for genuine repair and recovery. During deep sleep stages specifically, your eyes undergo measurable physiological repair processes: tear film replenishment, reduction of overnight intraocular pressure fluctuations, and clearance of metabolic waste products that accumulate in ocular tissue throughout your waking hours. Research published in the journal Sleep has documented that adults who consistently sleep fewer than 6 hours per night show measurably higher rates of dry eye symptoms, increased eye strain complaints, and in some studies, accelerated progression of certain retinal changes compared to adults who maintain 7 to 8 hours of consistent sleep. This means that no matter how diligently you practice distance focus breaks, full blinking, or accommodative flexibility exercises during your waking hours, chronic sleep deprivation works directly against the recovery processes those techniques are trying to support. If you are doing everything else right and still experiencing significant eye fatigue and strain, I want you to honestly evaluate your sleep before assuming the problem lies elsewhere. 7 to 8 hours of consistent, quality sleep is not a luxury in this conversation. It is a foundational requirement that makes every other natural approach to vision support meaningfully more effective. Now, I want to bring this together into something genuinely useful, because I think the real message here, the one that actually matters, is more hopeful than a simple yes or no answer would suggest. If your vision concerns involve eye strain, fatigue, dryness, or difficulty shifting focus that worsens with prolonged near work and improves somewhat with rest, functional approaches like structured distance breaks, accommodative flexibility training, conscious full blinking, and palming can produce real, documented, meaningful improvement in how your eyes feel and function day to day. This is genuinely worth implementing. It costs nothing, and the evidence behind it is solid. If you have been diagnosed with early structural changes, intermediate macular degeneration, mild dry eye disease, early lens changes, appropriate nutritional support, the kind backed by research like the AREDS to study, can meaningfully slow progression and support functional measures within tissue that remains healthy. This is a genuine, evidence-supported intervention that belongs in your eye health routine alongside, not instead of, your regular eye care. And if you have genuine structural disease that is actively affecting your vision, please do not delay appropriate medical care while searching for a natural alternative that does not exist for your specific condition. The earlier serious eye conditions are properly managed, the more vision is generally preserved. Time matters enormously in ophthalmology, and I have seen too many patients lose meaningful, preventable vision because they spent months or years pursuing approaches that sounded appealing, but had no realistic mechanism for addressing their actual diagnosis. The most powerful thing you can do for your long-term vision is not choosing between natural approaches and medical care. It is using both intelligently, in the right combination, for the right situation. Functional eye exercises for strain and fatigue. Targeted nutrition for supporting healthy tissue and slowing age-related decline. Consistent, quality sleep that allows your eyes to genuinely recover. Regular comprehensive eye exams to catch genuine structural disease early, when intervention is most effective. And appropriate medical treatment, without delay, when a real structural condition is identified. That is not a compromise. That is what actually works, based on the totality of evidence we have. And I genuinely believe it serves you far better than either extreme, the dismissive position that nothing natural matters, or the irresponsible position that natural approaches can replace necessary medical care. I want to close with something I tell my patients regularly, because I think it captures what I am trying to convey today. Your vision is not a single, monolithic thing that is either healthy or failing. It is a complex system with multiple components focusing muscles, tear film, retinal tissue, the optic nerve, the lens, each of which can be affected by different factors, and each of which responds to different kinds of support. Understanding which component is actually involved in your specific concerns is the difference between wasting months on an approach that was never going to help and addressing the actual issue effectively from the start. If your eyes feel tired, strained, and dry by the end of a screen-heavy day, that is very likely functional, and the approaches I described today can genuinely help. If you have been told you have early changes in your macula or your lens, nutritional support has real evidence behind it for slowing progression. And if your vision is changing in ways that concern you and you have not had a comprehensive eye exam recently, please make that appointment. Not because natural approaches do not matter, but because knowing exactly what you are dealing with is the foundation that determines which approach will actually help you. If this conversation gave you something genuinely useful today, a technique you are going to try, a clearer understanding of what is realistic for your situation, I want to hear about it. Leave a comment below. Tell me which category your concerns fall into. Tell me what you are going to try first. I read every single comment, and I want to understand what you are working through. If you found this valuable, please hit the like button. It helps this honest, balanced information reach people who are searching online right now and finding nothing but extreme claims in either direction, people who deserve the nuanced truth rather than a miracle promise or a dismissive denial. And please subscribe to this channel if you have not already. We are here for adults over 50 who want real evidence-based health information delivered with the honesty and respect you deserve every single week. Share this with someone who has mentioned struggling with their vision, or their eyesiman who might be tempted by an online promise of a miracle cure, or someone who has given up on the idea that anything natural could genuinely help them. The truth, as it usually is, sits in the middle, and I think they deserve to hear it as clearly as you just did. I am Dr. Richard. Real information, real expectations, real results, where results are genuinely possible. Take good care of yourselves, and I will see you in the next one. This content is for educational and informational purposes only. It does not constitute medical advice, diagnosis, or treatment recommendations. Always consult with a qualified healthcare professional regarding any vision concerns or before making changes to your eye care routine. Watching this video does not establish a physician-patient relationship.